Thank you so much for joining us. We are discussing Tarleton's doctoral program in physical therapy, one of our newest programs here at Tarleton, and I'm pleased to be joined by several representatives from the program. As they're going through their presentation, if you do have questions, we ask that you submit them using the chat box or the Q&A box, and we will handle those at the end. So at this time, I will just turn things over to our faculty members.
Hi, everyone. I am Dr. Dawn James. I'm the program director for our developing Doctor of Physical Therapy program here at Tarleton.
Hello, I'm Dr. Elena Newman. I'm the Director of Clinical Education for our program.
I am Dr. John Cosnawala, and I'm one of the core faculty members.
I'm Dr. Chris Riggs, and I'm a physical therapist teaching in the program.
All right, so I'm going to start with a quick overview of the university. It was founded in 1899 and is a founding member of Texas A&M system in 1912. It's located in rural Texas in Stephenville. It's about 70 miles southwest of Fort Worth. And our population of students is almost half first-generation students, and we're designated as a military-friendly school. So our mission and vision, everything kind of connects from the top down. For the university, the mission is Tarleton State University, a founding member of the Texas A&M University system, transforms generations by inspiring discovery, leadership, and service through educational excellence. In the vision, Tarleton will be the premier comprehensive university in the nation with a keen focus on student success, teaching, and research. Then the vision of health sciences, where our program is housed. Our mission is to champion a comprehensive, collaborative learning environment to cultivate interprofessional practice through interdisciplinary experiences that develop competent leaders dedicated to advancing wellness, fairness, and justice. And the vision is to be the premier College of Health Sciences whose graduates are compassionate, transformational leaders who advocate for the various communities they serve. And this is us. So our mission in our DPT program is to educate and graduate compassionate and skilled primary care physical therapy professionals who advance the profession, promote fairness and social responsibility, and transform the health of society through excellence in education, discovery, leadership, and service. And our vision is to be a leading force in physical therapy education, inspiring exceptional care and transforming the human experience by optimizing movement. Our accreditation status, one of our most asked questions. So we have been approved by both the Texas Higher Education Coordinating Board and SAC-COC, the Southern Association of Colleges and Schools Commissions on Colleges. We submit our application for candidacy on November 1st. And once they review it, they'll determine if the program is granted candidate for accreditation status. Candidacy is in accreditation status. So the first cohort will begin the program only after candidacy is achieved. And by the time you graduate, it'll be a CAPTE accredited program. So how our program is set up, it is a 3-year program with blended learning. So blended learning, it's not hybrid, it's primarily on campus, but there will be different courses that have some online learning, both synchronous and asynchronous. And then our rotations all fall in the 3rd year of the program after all of the courses take place. So start date is June, and then graduates will graduate 3 years, May of 2029. So we have a couple of unique pathways with our program. Anyone in the Texas A&M system, if you meet the minimum requirements, the 3.2 GPA, and do the priority deadline of October 1st, you get an automatic interview. As kind of a caveat, the October 1st deadline, you have to be verified, and verification can take 4 to 6 weeks. So you actually have to submit before that October 1st. And then the physical therapy assistant pathway, if you have a bachelor's degree and are a licensed PTA, you don't have to meet the prerequisites. You're on the alternative admissions pathway. Curriculum design. So we have 6 key curricular themes, and they're all threaded throughout the entire curriculum. There are a few courses that do emphasize all of these, especially rural health is in a few. Interprofessional collaboration. There's an interprofessional course in the second semester of the program where you go on experiences in the community with different healthcare professionals. It's kind of learn what they do, how to communicate with them, how we can improve patient care by good collaboration. Um, Evidence-based practice. There are 3 evidence-based practices courses throughout the curriculum as well. So you kind of start learning the foundations of research and you grow on that eventually until you do your capstone. And then clinical competency. The entire program is a competency-based education. So every course, there are certain things you should learn from it to be a good physical therapist, skills, knowledge base, whatever. And by the end of it, everything you learn in every course should get you ready to be an entry-level physical therapist. And we're kind of a unique campus. So it's an undergraduate campus. So you have all the resources from that, but also we have a bunch of different healthcare professionals on campus. So we can collaborate with them in class. We also have kinesiology researchers who are eager to have students come help and learn from research, and eager to have people from all different professions working with them. This is what I was referring to, the competency-based education. So it's outcomes-based approach organized around societal and patient needs. And it's designed to facilitate greater accountability, flexibility, and learner-centeredness. So it's all of the competencies are based on what knowledge, skills, and attributes you as a physical therapy student should gain and be comfortable doing by the time you graduate. So this is kind of small, but it's the full course sequence for the 3 years. You can kind of see the summers are lighter because they're shorter, and then those clinical experiences are in those last 2 semesters. And then if you look really close, you can see how those key curricular themes are threaded throughout the curriculum. Health education. This is my go-to. So it's kind of a scaffolded clinical education. We start out in the first year with the interprofessional education experience, where students are really just trying to get their feet wet and full circle all the healthcare team together. And then second year, integrated clinical experience. You are with physical therapists in the community, a few hours a week, kind of learning what to do and applying all those skills you've been learning for the last 2 years. And then third year is when you go out on rotations, and they're 8 weeks, 8 weeks, and 15 weeks. So that's 31 weeks of full-time clinical experiences. And then our requirements for our program, 1 clinical experience needs to be in a medically complex setting. So home health, long-term acute care, skilled nursing, acute care, pediatric, adult. Then there's some other ones in there. Rural, and rural also includes those communities that are resource limited. And then an elective, your choice. So we want to work with you to get you if you want to do pediatric, primary care, emergency medicine, orthopedics, sports, whatever. And they're not necessarily in that order. And some could potentially count as both and then get you into different leeways. It just depends on where your interests are.
All right, so a little bit about the admissions process and requirements for our program. So prior to matriculating, you must have a bachelor's degree. So it's okay to apply prior to finishing that. You just need to know that you will have to complete that degree before you're able to begin in June 2026. So our minimum GPA is a 2.5, and that's the minimum for the College of Graduate Studies at Tarleton. So you'll gain admission to the PT program, and then you'll also have to get admission to the College of Graduate Studies or apply to that. So this ensures that you won't have any problems with that once you've been admitted by us. We do not require the GRE, but you can submit those scores if you've already taken it, and we will keep that in mind as we review your application. It won't hurt you, but if it's a data point you feel like you did well at, you can turn that in. We do not require observation hours because we know depending on your location, if you're in a really rural setting, it can be really difficult to find a therapist to shadow. But we do encourage it if you're able to, just so that you know what you're getting into with the profession. And then there will also be certain immunization, background checks, and drug screenings that you'll have to complete. And part of that's also to ensure that you're able to gain clinical placement once you've been admitted into the program. So the prerequisites we require are 2 semesters of biology, chemistry, anatomy and physiology, or a semester of anatomy and a semester of physiology, depending on how your school breaks that up. 2 semesters of physics, then a statistics or a math course, and a psychology course. And then the specific hours that we require is listed out right there. So you will need to submit your application through PTCAS. That's going to also include submitting official transcripts from everywhere that you've attended school at. So even if you took some dual credit classes in high school, at a junior college, you'll need to submit those transcripts as well. That's one of the common things that we see applications get kicked back for, is because they submitted PTCAS and they left something out. Or there's been some kind of transcript issue. So that's another reason you want to submit early so that you get those issues taken care of. It sometimes will just take a little while. You will need 2 letters of recommendation, and ideally one of those is from a PT, again, showing that you're aware of what the field entails. You will also have to submit a personal statement that everyone in PTCAS requires, and then a program-specific Tarleton essay that we require. And again, that verification process can take 4 to 6 weeks. So you want to start early to make sure that your application gets verified and you're able to be considered prior to that deadline date. And then if you are interviewed by us and then admitted to the program, we will then direct you to turn in a supplemental application to Tarleton's College of Graduate Studies. But that's not something you need to do until directed by our program. So we have rolling admissions, which means that we are reviewing applications as they come in. We'll have several interview dates, again, depending on our admissions, when they're turned in, or applications. Our priority deadline to be verified is October 1st, but our final deadline is May 1st, but that will be dependent upon seats remaining in the cohort at that point. And our interviews begin in October 2025, so it's coming up really quick. So, if you're on the fence about or haven't quite got your application fully submitted, go ahead and you want to get that done because these fall dates are coming up quick. We use holistic admissions, which means we consider the entire applicant and their experiences, attributes, and metrics. We think that there's a lot of different ways you can demonstrate that you can be a successful physical therapist, and we want to account for all of that. So I mentioned interviews. So we're going to have in-person interviews. The first one's going to be in October. That's going to involve faculty, community members, and clinical partners. But if you live a long distance away and are not able to come to that, or have some kind of scheduling conflict, we will have a Zoom option as well in the fall and the spring. So if you're concerned about distance and whether or not you'd be able to make it in for an interview, if you were offered that option, so go ahead and apply, because we're trying to accommodate you with that Zoom option. We, within our program, and our university, have a lot of different aspects of student success. Our program is going to offer academic coaching. Our division of health science has the academic resource hub, which bundles in a lot of different resources and guidance for students. We also have the writing center and library, and we are actively developing more supplemental instruction and tutoring options, which allows students to get a little bit of extra help, as well as gives them an opportunity for employment and to make a little money while they're a student. We are working on getting graduate assistant positions, not just in our program, but there's several within the university as well. We are going to have a practice board exam, which is the PEAT, and then True Learn, which is board exam style questions that will be threaded throughout the curriculum, and then we can assess how students are doing in certain areas and offer guidance based on those results. So student life at Tarleton, as Dr. Newman said, it's a big undergraduate campus, and we're developing more and more graduate and health professional programs. So that's pretty exciting because I feel like you get the best of both worlds. We've got a lot of developing health professions such as occupational therapy, PA. We already have nursing, so you get to interact with all those other students. We also had D1 sports, and we just are opening up a new event center, which will house basketball games. Where they've already got a concert scheduled, comedians, a lot of different things like that on campus. You'll also have access to the rec center, all the clubs on campus, the aquatic center, intramurals, just a lot of different things to give you a good experience while you're here. There's also student health services on campus, as well as student counseling services. So an important factor to think about when you're looking at your DPT education is cost, and our in-state tuition and fees for all 3 years would be a total of just under $63,000. And that's before you get scholarships or financial aid or anything like that. So I feel like we're very, very competitive there. And then out of state, the total cost, again, after the 3 years would be about $103,000. But out of state students who get a $1,000 merit-based scholarship, and certain GA positions will also qualify for in-state tuition. So that's another reason why you want to apply early, get admitted, so you can go ahead and start applying for scholarships and try to qualify for that in-state tuition if you are an out-of-state student. And I would say our program is also actively seeking more and more scholarships and trying to develop those resources. And another thing that Tarleton does is reimburse licensure fees for graduates who pass on the first attempt. So, that's around $500. So once you finish school, you graduate with your DPT, and then you take your board exam. And if you pass on that first try, Tarleton will reimburse you that fee. So that's a great opportunity for our graduates. Just briefly on PT salary, it really varies a lot across states and setting. So in Texas, the mean salary ranges somewhere between 100 and 114,000 as of May 2023. That can really depend on what setting you're in, what your position is, how many hours you're working. But still, I think that's very competitive if you can keep your cost of school reasonable. So I think that's it's still a good field to go into. There's lots of projected openings right now. So I think this is also a good state to practice in based on that salary. So what questions do you all have for us?
Yes, to our live audience members, we are now open for your questions. You should see a Q&A box that you can use to submit your questions, or feel free to use the chat box as well. While we're waiting for those to come in, I do have some questions of my own. And here is the contact information for relevant departments. So you'll certainly want to make note of this and reach out to those departments that you feel like you want to engage with more. And I'm going to change our view here so that we're seeing everyone. And I have some questions for you, Dr. James, because I know you were the first person to come to Tarleton as the founding director of this program, and you hired all of our faculty members here and have been responsible for getting things off the ground. I want to just hear a little bit from you about what it's been like to start a new DPT program from the ground up.
Sure. So this is, I've had a weird journey in DPT education. This is my third new program that I've been a part of. I started teaching in a brand new program. And then went with one of the faculties from that program to start her program that she was starting. So being here at Tarleton and starting this program it's been really exciting. So when I started the program, we were actually meeting with architects and planning the building. And it's been a very collaborative process between occupational therapy, the physician assistant program, and the physical therapy program. In developing these three brand new programs and building this building and making sure that we have all of the resources that students are going to need. One of those would be our anatomy lab. And our anatomy lab is really, it's really, I think, something special. And you'll have to see it and come for a tour and check it out. But it's one of the most up-to-date and multimodal anatomy labs that I've ever seen. We have syndavers, so synthetic cadavers that are very realistic. We have, I think, 4 of those that are in the anatomy lab. We have plastinated cadavers, if you've ever seen Body World, those kind of cadavers that are preserved and available at all times. And we have a lot of technology that's in the lab. So we have Toltec tables or Toltec screens, and we have virtual reality in the anatomy lab. So students have multiple ways to learn anatomy, whether you're a hands-on person, whether you're a more visual person. And we got a tour and a little sneak peek of the anatomy lab last week, and they're actually using our anatomy lab as a model to develop some of the other ones with Toltec, which is a company that we've partnered with quite a bit to use that. And so kind of PA and physical therapy will be primary users of the anatomy lab. And I think one of the other things is that it's available at all times. So if you're in anatomy in that second semester, but in third semester in cardiopulm, you want to go back and visit the anatomy lab, because our resources are there all the time, it's always available and there for students to go back in and use. I think one of the other things that's Tarleton specific is that this is, it has been a place that has really allowed us as faculty and as programs to do some new and exciting things, competency-based education. It's a new way to teach in PT school. We were able to build that from the beginning and make sure that our students are really learning the competencies and that they're gaining the knowledge. They're not just passing tests, and that there aren't have holes, that they don't have holes in their education as well. And we partnered really closely with um, our clinical partners in the area, and they've been helping us develop and giving us feedback as we move through in what a PT program really needs to look like in order to produce graduates that are practice ready and ready to engage in primary care and rural practice and underserved practice. And I've really found Tarleton to be an incredibly welcoming place. And John is an alumni, or Dr. Castamuela is an alumni. And so if you have questions about what Tarleton life is like, he's definitely the person to ask. So I don't know if there's anything else you want to know, but that is kind of my experience over the past 2 years.
Thank you so much. I have lots of questions, and we see some audience questions coming in too, which we'll get to. I don't want to assume knowledge. So for the benefit of people who do not know, Tarleton actually operates in many locations. We've got our main campus in Stephenville. We are in Fort Worth, Texas, Waco, Texas, Bryan, Texas, and then of course we also have online programs. But just to be clear, this doctoral program in physical therapy is based at the main campus in Stephenville. I don't know if we said that specifically, but as you heard us allude to, there's a brand new building that is opening this fall semester that will house all of these health-related disciplines: physical therapy, occupational therapy, physician's assistant, and so forth. So can you explain a little bit for people who know they want to do something health related but are not necessarily crystal clear? What do physical therapists do as compared to some of these other professions like occupational therapy or physician's assistant? And what settings could they potentially find themselves in professionally?
Sure. I'm going to start off and then if everybody else can kind of talk about the practice settings that they're in. I'm a pediatric physical therapist, so I have worked at Shriners Hospital, working with kids who are post burn recovery and orthopedic and prosthetics and orthotics kiddos. I have also worked in a school district and in early intervention, working with babies coming home from the NICU. So I actually work directly with the families in the homes and help the families figure out how to optimize their children's development. I also work with USA Track and Field Paralympics or volunteer. I don't get paid for that one, but that is also a place that you'll see physical therapists in, specifically in sports. I work a lot with veterans and people who have had accidents or who have some type of neuromuscular disorder that requires adapted competition. So if you guys could talk about some of the other areas that you practice in, and then I'll talk about some of our other faculty and where they are as well.
So I've been primarily in outpatient orthopedics, doing anything from chronic pain to sports and athletes, collegiate, high school, all of that. And just kind of how my life has gone, I've opened myself up to a lot of other settings, acute care, ICUs, inpatient rehab, and skilled nursing facilities. Things I think as a student, I was like, there's no way I'm going to be doing that. And then life happens, and it's really nice to have those skills. And I do appreciate all the settings now and the variability that your career can take you. Because, physicians, they do one and they're kind of stuck. We're like, oh, I'd like to switch because XYZ, and we can. So that's me.
I practiced at a rural hospital about 45 minutes away. I saw a little bit of everything. We would get like pre-op, post-op, back pain, neck pain. We would see occasional hand surgeries, some pediatric patients, and then might have a wound right after that. We would then go up to see patients within the small acute care hospital, and then some that were on a longer term stay, more similar to a like an inpatient rehab. So, as Dr. Newman said, very variable. I have got to see a lot of different patients, and that's really nice. You could get bored if you see the same thing every day. If you wake up one day say I don't want to really practice outpatient anymore, you can just switch and go do home health or neuro or peds or anything like that. So that's something I really like about therapy, is all the different settings you can be in. I've also enjoyed getting to spend so much time with patients. We did about 45-minute treats, or treatment sessions. So not all professions get to spend that much time with patients, but I really enjoyed that. I felt like patients had really respect what we do and what we have to say when they get to pick our brains for that long, and talk with us and really hear our knowledge level. So I enjoyed that a lot.
All right, I'm Chris. So I worked in Veterans Affairs for most of my time, and I really enjoyed it, taking care of our nation's veterans. We get to take care of the full spectrum of the things that they're dealing with, whether it's a spinal cord injury or Parkinson's, getting them equipment like specialized wheelchairs, power mobility. And then we also did some home evaluations. So if we need to modify a bathroom so that they have better access to take care of themselves, we like to age in place. So whatever resources they need, we try to provide that. Um, in the outpatient setting, it's just rewarding to be able to work with people who have different types of injuries or illnesses and get them back on track to living a productive life, whether they've just transitioned out of the military or whether they were in Korea and they're end of life and they're just trying to figure it out so they don't have to go into a nursing home. Or if we transition to that nursing home, we also try to provide the care that they need.
Very good. It's amazing to hear the diversity of settings, but obviously you're making such a huge impact on people's lives. I want to ask you about the verification process that you mentioned as part of the application process. What is happening with that, and Why does it take so long and what specifically is being done?
So the verification process is the PTCAS or the application service ensuring that all the documents that you have sent in are official, that when you have your letters of rec and the person that you sent them to or requested a letter of recommendation from, they have to fill out the link that was given to them. So it's good to ask those early, because if you ask someone to write you a letter of rec and they're really busy and it takes them several weeks, you can't be verified until that occurs. So it'll take time for your official transcripts to come through, your letters of rec to come through, and that's, I think, typically what takes the longest in the verification process.
And so people would find the PT-CAS application how?
There is a link on our website, and you can also like Google PT-CAS or physical therapy application, and that should bring it up.
Thank you. So this program is based in Stephenville. When are you enrolling new students? And is it a cohort-based program where people come at the same time and then stay together for the whole 3 years?
It is a cohort-based program. You asked when we were enrolling. So we are going through admissions, pre-enrollment, pre-registration. Our students won't officially be enrolled until after we hear back from our accrediting body and make sure that we have that initial candidacy status. I honestly, personally, feel like we are on a really good track and have no worries about the accreditation process. I'm actually a reviewer for our accreditation agency, and we have other faculty who serve with CAPD in a variety of different roles. So official enrollment will be the end of May, but we will be accepting students as they come in with the rolling admissions program.
And so end of May for us is considered the summer term.
Yeah, we'll start June 6th or 8th. I do not remember the exact date.
Okay.
It's the 8th.
How many students are you wanting for the cohort?
Our cohort size is set at 75.
Oh, all right, nice. So,
Hold on a minute, with a caveat. So 75 can sound like a really big cohort. Our lab sizes, we're splitting our labs up into 2 different groups. So the labs will be no more than 40 students per lab section, and we'll have multiple faculty in those labs, 3 to 4 faculty. So our student ratios is 1 to 15 in the lab classes.
I have seen the facilities, they are top notch. Just, it's a beautiful, beautiful space, just state of the art. And any student would be lucky to be able to be a student there. So, just to be clear, this is a doctoral program, but people are eligible to enroll in it straight from their bachelor's degree, correct? And so is there a typical major that people have when they come to PT school? Who's your ideal student? Who do you see as being successful in the program? What makes for a good physical therapist?
That's actually one of the questions in the chat as well. But as far as majors, I get a lot of PT students come in with kinesiology or exercise science majors, but that's not required. I've had students who were philosophy majors, law school, pre-law majors, and if anything that called to them in those first 4 years of school, as long as they do their prereqs and have their prereqs completed. The question in there is what kind of a student do you see thriving in our DPT program? And for me, the students that I see do the best are students who really want to make a difference. When we look at back to our mission, it is really developing that compassion, that empathetic healthcare provider, somebody who wants to work closely with their patients and clients and is really invested in health and wellness. I really strongly believe it's service-oriented, compassionate. People make the best clinicians because One of my favorite phrases is nobody cares how much you know until they know how much you care. And that caring part, I think, is very central. And I don't know if any of the other faculty have thoughts on what kind of a student they see thriving.
I was a history major, so let's get that out of the way. No, I was in that pre-law track, and I did an internship and realized law wasn't really what I craved. But I do agree, a sense of purpose is what physical therapy is. You get to step into a role where people depend on you, and every patient you interact with, you take away something as well. You get to provide the support they need, and it's very rewarding.
Yeah, and you know, specific to Tarleton, I feel like it's a very welcoming campus. I think we have a lot of resources, both on our side as like a health professional program, but then just campus wide. So I feel like it's a easy place to thrive, and we're really looking forward to getting our students here.
We got a viewer asking if you plan on holding any on-campus open house events or any physical therapy specific tours.
Yes, so we have 4 on-campus open houses, and they're all from 10 to 12 on Fridays. The September 19th, December 5th, February 6th, and May 1st.
Wonderful. And I know you got several webinars scheduled for the rest of the academic year as well. So for our viewing audience, tell your friends if you know anyone who also would be a good fit for our physical therapy program. Have them join the next webinar, which I believe is scheduled for September 18th or thereabouts.
Yep.
Yes. Right. Someone's asking about the clinical experience, and I had questions about that as well. She's asking, do you have any clinical rotation partners now? And I was wondering, is the burden on students to find their own clinical experience, or are they assisted with that?
No, we have a lot of clinical rotation partners. Hundreds, can I say hundreds? Majority in Texas, but also Kansas, Oklahoma, Louisiana, Florida, California, Pennsylvania, South Dakota, Nebraska, Minnesota. They're all over the place. And if they're kind of like I said, that specialty rotation, if there's something specific that you really, really want to do, we want you to do it. So it's flexible.
Can I talk about my favorite clinical
Yes.
site that we have? Dr. Newman was able to secure a site that is a canine rehabilitation site. And so our students will be able to actually go out and work with dogs and do physical therapy with dogs. That one's in Nebraska, correct? So that's my favorite. That one and the one in Hawaii.
Wonder why. Thank you so much. Well, we got another good question from an audience member who's asking, what do you hope the first graduating cohort will be known for in the PT community?
Our values are the same as Tarleton's values, which is respect, excellence, and integrity. I hope that our students are known for, I'm going to go back to empathy and compassion as part of our mission. But I really want our students to be known as excellent clinicians and all that encompasses, like clinic ready when they graduate, ready to go into the clinic. What about our other 3 faculty?
Yeah, hopefully expert clinicians, hopefully critical thinkers, and I think innovators too. I think coming into a new program, sometimes it's easier to incorporate some of these new things that are coming out than maybe if things have been done the same way for a long time. So I know like Dr. Riggs does a lot of diagnostic imaging, so we're excited to offer things like that, which I don't think everywhere will have things. We've got a very encompassing anatomy lab. Some of those things that they'll learn in the lab, you can get that service after you're graduated if you would like to incorporate that, with the 3D anatomy and virtual anatomy and some of those resources.
Dr. James, you mentioned the competency-based education and how it's really innovative for the physical therapy education space. How is that assessed?
So I'm going to start this, and Dr. Newman, I know you've been working a lot on this lately. So if you want to chime in, feel free. But competency-based education, our program, it is still time sensitive in that we are still based on semesters and terms. But what that allows our students to do is to really focus on the learning. We don't have letter grades in our classes. They're all pass fail. And so as students go through, they need to demonstrate competency in every skill or every assignment, every assessment that we are looking at. And so that means for us getting an 80% on exam. That doesn't mean that you get one shot at getting an 80%. It means that you take the exam and you learn from your mistakes. You truly get an opportunity to learn from your mistakes. You then go back and kind of enrich your learning in areas that you didn't do so great. And then you can retake that exam. But it really looks at specific competencies and essential skills that all physical therapists do, no matter what kind of practice area that they're in. So those things are gathering information from your patient, doing a history and a physical exam, looking at tests and measures and how do you examine that patient, documentation, using evidence in practice. So those are some of the competencies that we're looking at. Communication is also a really big one. And so without the pressure of getting an A per se, students will be really hopefully be able to focus on the learning, not necessarily on that grade. I think a lot of times in PT school, we have a rule that's typically in most programs where you get 2 opportunities to take a practical exam. And if you don't pass it in those 2 opportunities, then you're out of the program. I strongly believe that we really need to make sure that our students are learning the skills and not just taking an exam to learn or to pass a test, but really to gain all of the skills that they're going to need as clinicians to interact with the variety and depth and breadth of patients that they're going to encounter.
Amazing.
Do you want to add anything, Dr. Newman?
Yeah, I think it's also it really is about learning the skills. Like the classes should teach you how to do very basic skills, and then it's not a checkbox, but once you pass all the competencies, we're saying, hey, you're ready to go out on clinical experiences, take these basic skills, develop them so you can graduate and be a good, competent entry-level clinician, and then develop them more and specialize or open your own business or do whatever you want to do. It's based on students and student success.
Very exciting, very exciting. Dr. Newman, you had mentioned earlier in the presentation about the coursework and how it's blended and moved throughout asynchronous versus synchronous. For people who may not understand what that means, can you explain further?
Sure. So with blended learning, the online options, synchronous, where you have everybody in the class on at the same time with the teacher and you're doing activities together, versus asynchronous, you might have some stuff to work through online, some question to answer, a little activity to do, but you don't all do it at the same time together. So it's a little bit more flexible learning. Dawn, anything to add?
So when you look at our curriculum, different courses are going to need to have different structures to it. So we have a Foundations of Anatomy class in the first semester. That is really to make sure that all of our students come in on the same page with their anatomy knowledge to our big anatomy class. That's an online, self-paced course. And then we have our pathophysiology class. Our pathophysiology class right now is structured where lectures are being recorded and available to students, and then they're going to come into the class and do active learning components and really put that information that they learned in lecture to work within a class. And so it depends on the content and how student learning is going to best be facilitated with that content. All of our labs are on person, are on campus. Our professional development courses are mostly in person because I think it's really important for students to get to know each other and to talk through some of these concepts that we're talking about in professionalism and laws and ethics. And other content could be served better online. And so it really is looking at truly at how can we optimize student learning with these different delivery modes.
Very good. We'll talk a little bit about the admissions process. What are some of the benefits of trying to meet that priority deadline of October 1st? And if people maybe are learning about Tarleton later in the process, say February, March, will there be space for them in the cohort if they applied so late?
So the one of the benefits of applying prior to the priority deadline is basically first consideration. There's obviously we have our 75 seats right now, and that number is going to dwindle the longer you go on. For our Tarleton and our Texas A&M system graduates, also if you meet the minimum standards, have a 3.2 GPA, and are verified by that priority deadline, then you get an automatic interview. So hopefully that will take some of the stress off you, and you can really give yourself a good opportunity to get one of those seats early on. And versus again, the longer you wait to apply, the less seats are available, and you might also be looking at like if you're on a wait list somewhere, then you're waiting for someone else to give up their seat. So it's nice just to apply. And if for some reason you needed to get some feedback on something, that gives you more time to do that.
And these are group interviews, correct? And what can people expect from those?
I would like to describe our interviews more as a conversation than like a job interview. That's kind of my vision. I think that when you're trying to decide what PT school to go to, this is a place that you're going to spend the next 3 years of your life, and really making sure that it's a match, that you're a match to our mission, that our program is a match to you, and that this is a place, and these are people, it's faculty, that you feel like you want to spend the next 3 years of your life with. So that group interview process is I really like having community members in it, having our clinical partners in there, getting a wide range of feedback about how these interviewers, how they view our candidates' skills, their communication skills, etc. And it just adds to the holistic nature of our admissions process.
Thank you. And I think I've heard Dr. Newman mention something about an alternative admissions pathway for physical therapy assistants and Texas, was it also Texas A&M affiliated students? And so
Yeah.
how does that differ from the traditional route?
Gosh, a lot of programs don't have an alternative pathway for PTAs. They have to meet the same minimum requirements as everyone else does applying. We value experience that PTAs have, and we think that experience should qualify you to at least apply to the school and be looked at by admissions.
Very nice, very nice. So
I would also add with the PTAs applying if they took maybe biology and it's been a while, and then they took that maybe 3 or 4 years before PTA school, and then they went to PTA school, which lasts 2 years, and then they practiced for 3 or 4 years. It can push some of the prereqs they've already taken outside of a 10-year window that a lot of schools will use. So with our program, they can still apply and not lose credit for even the prereqs that they may have already taken.
And that's a huge benefit, huge benefit. I, go ahead.
The Texas A&M, you asked about the Texas A&M system. So because we are part of the Texas A&M system, we really value our system. We feel that we want to support the system and the students who've gone through that system. And so students who are candidates who apply have that 3.2, I think Dr. Castanuela talked about it earlier, a 3.2 GPA, meet all the prerequisites and meet that priority deadline, have a guaranteed interview spot for our program.
Exciting. I was very interested to hear that the licensure fee is reimbursed for people who are successful on the first try. Is that typical of PT schools?
I'm going to clarify that just a little. It's the MPT examination fee, not necessarily just the licensure fee, because licensure is done state by state.
Okay.
But it is not typical.
Okay.
It's something that Tarleton does with a lot of our programs that require licensure or board exams, and something that we feel very strongly about supporting our students getting into the workforce.
So to inform people who may not be aware, because I'm outside of your discipline, it's sounding like MPT is a national board exam. Is that correct? And then people would still also have to, is there a state equivalent to that, a state exam or?
No, so typically all of our students will have to take the National Physical Therapy Exam, the NPTE. Some states require a legislative law or ethics exam. It's a much smaller exam. Texas does require one. I took mine sitting at home in my home office, so it's not a high pressure type of examination. And then if you want to get licensed in different states, you still use the same scores and that same exam from the NPTE because it's a national exam.
And so Tarleton covers what? $500 towards your MPT?
It is whatever the NPTE examination costs. So they will cover, as long as you pass on that first attempt, the NPTE examination fee.
That's amazing. And then I heard some mention of a practice board exam, PEAT. At what stage would that be available for people?
So when they showed that overall kind of viewpoint of our curriculum, the last 2 semesters, we have a doctoral seminar course, doctoral seminar 1, doctoral seminar 2. That course is getting your capstone project, research project ready to disseminate and share, and also is part of our prep for the MPTE exam. And so that exam was the PEAT, which is a practice examination and assessment tool or test. And that is a retired examination that is provided by the Federation of State Boards of Physical Therapy, who administer the National Physical Therapy Examination.
Wonderful. So that is a test that actually was used in the past as the board exam, and now people are getting the benefit of seeing those questions. Very good. Well, this has been amazing. We're so excited for this program and all the health related programs that are coming to Tarleton. It's a very exciting time. I want to end by asking you, Dr. James, I know you seem very confident that it's just a matter of time before this program receives its candidacy status and then the full accreditation by the time the first cohort graduates. But for people who may be risk averse, what can you tell them if they have any hesitation about trying a program that is untested at this point?
I would say, yes, I'm absolutely confident. This is my 3rd new program. Of course, I can't guarantee anything, but I've watched how this faculty has come together and supported our preparation and all of the amazing things that they're doing. We have an expert consultant who is helping us as well, reviewing all of our documentation, making sure all of our I's are dotted and our T's are crossed. But what I really want to say is that it's really cool to be part of creating something new. And that first cohort, they're going to get to create the traditions. They're going to get to really help make this program what it has the potential to be. And they're going to be very valued and very instrumental. And somebody asked about the group interviews. Yes, you would be in an interview with other candidates. Once we have our first cohort in, our students are going to be sitting in on those interviews and acting as interviewers as well. And so I think that's the exciting part, is really helping us as faculty completely develop and test out this brand new program. And we have really great facilities and brand new buildings. So I think that's also really exciting.
I'm just so happy and excited for all of you and for our live audience members and even those who are watching on demand. If you've got a pioneering spirit and a caring spirit, service-oriented spirit, and see yourself in a health care setting, this program is a great option for you. And I've seen the facilities you will be in. They're absolutely amazing, state-of-the-art, beautiful, so much light and energy. So you see the contact information there on your screens. Please do reach out to Dr. James and her team. We'd love to have you apply to the program and work through the process and hopefully be among our first cohort. This recording is going to be available to review on demand on the College of Graduate Studies YouTube channel. So if you know of others who could benefit from this content, please share with them. And of course, we invite you to rewatch as needed for your own benefit as well. And I think with that, we can end our webinar. Thank you so much to everyone. Have a great rest of your day.